Welcome everybody to recommendations for advancing HIV prevention and care amongst people who trade sex. This is presented by the Sex Worker Health and Harm Reduction Cohort. My name is Savannah Sly, and I'm a co-director at New Moon, and I'm here with my co-director, Melody KG. Melody, do you want to tell us a little bit about what SWHRC is and what they've been up to?
Absolutely. Hi, everyone. Melody KG. I use she, or they pronouns. I'm also a co-director with New Moon Network. The SWHRC cohort, so Sex Worker Health and Harm Reduction Cohort, was convened by us, New Moon, a field building organization in the US dedicated to advancing sex workers' rights through philanthropic education, funding, and capacity building. And this is one of our programs that we launched in at the beginning of this year. We would love to thank and congratulate all of the cohort members on completing this year of learning and contributing really meaningful information and data to the field and releasing this amazing publication that you see here. These outstanding advocates are contributors and leaders to sex worker-led organizations around the US, including Advocates of the South, Below Sea Level Aid, Boston Sex BSWAC,
Boston
CID
Sex
Collect.
Workers and Allies Collective.
Thank you.
Mhm.
CID Collective, Decrim 305, Entre Putas, Libs Tampa, Missouri Ho Justice, OSWC, Rio Grande Valley Harm Reduction, Suede Vegas, Swoon Alliance, Swap Hawaii, and Rouge Support Network.
And we're really proud of all these advocates, as Melody said. These represent advocates and organizations from all over this country, from Hawaii to Puerto Rico, Pittsburgh, Miami, Vegas, and everywhere in between. Thank you again to everybody who took time this year to come together and share your knowledge, to help create these recommendations so that people with lived experience in the sex trade can be better served and cared for. We also want to thank the people who funded this project. We couldn't have done it without our allies at ViiV Healthcare. It was through ViiV's Positive Action Grant that New Moon received the funding to help make the SWHRC cohort possible. We're going to drop a link in the chat to tell people about the Positive Action Grant and what we've done with it. So feel free to check that out if you would like. And also, we're going to be hearing this presentation today, but is it accompanied by a publication, dropping that in the chat. All these recommendations have been put into a beautiful online PDF that you can read, download, and share so that the knowledge that's generated here can reach other audiences. So thank you all for joining us. We're really excited to have you here. We have our facilitator from Reframe Health and Justice, Justice Rivera here, monitoring the chat. Feel free to drop your questions and comments there. But without further ado, would love to pass it to Maya from the SWHRC cohort to kick off the presentation. So Maya, take it away.
Hey y'all, thanks Savannah. Can you hear me okay? Okay, awesome. So my name is Maya Onikuroshi. Welcome y'all. Thanks for being here today. You could have been in a million different places, but you're here. I am calling in from Boston, Massachusetts. I use she series pronouns, and I'm representing the Boston Sex Workers and Allies Collective, and I have been a part of the Sex Worker Health and Harm Reduction cohort over the last 6-ish months. So we are here to share our presentation with y'all on public health best practices around how to work with sex workers, specifically around HIV prevention and HIV care. So I'm gonna call in Elle to introduce yourself, and we'll just one by one introduce ourselves briefly as your presenters today. And if you haven't had a chance to introduce yourself in the chat, please go ahead and do so.
Hey, everybody. Everyone can hear me okay? Awesome. Thank you. Hi, my name is Elle Stanger. I'm certified sex educator with ASECT and then longtime adult industry worker. And so happy to be a part of this with so many other interesting, unique, knowledgeable people in their lived experience and around the world. So What we did, what we focused on, and what we have to present to you is recommendations for advancing HIV prevention and care among people who trade sex. And we are the sex worker health and harm reduction cohort. Was there anything else you needed from me about me or otherwise?
I think that sounds like it, Elle. Maybe we can pass it to Div next to introduce yourself. Thanks, Elle.
Thanks, Maya.
Yeah, hi, I am Div Savell, representing Suede Collective of Las Vegas, Nevada. And thank you all for being here. It has been amazing working on this project throughout the year with you guys.
Thanks, Div. Kiki, can we pass it to you?
Sure. Hi, everyone. I'm Kiki Walker. I'm an organizer with Sex Workers Outreach Project Hawaii. Hearts, cute. I'm yawning. Um, yeah, just excited to have been a part of this project. I think it was really impactful, and I'm excited to see if we can share this with some public health spaces here in Hawaii, just because I'm sure, like across the country, there's not a ton of information that comes directly from sex workers about us. So this is an exciting opportunity for that. Thanks for, yeah, being here.
Thank you, Kiki. And Justice, may I ask you to unmute and introduce yourself?
Hi, everyone. My name is Justice Rivera. I use she, they, AA pronouns. I'm with Reframe Health and Justice and have had the pleasure of getting to facilitate this cohort over the past 10 months and getting to basically just kind of like edit and compile the recommendations that this group made and is going to be showcasing you all today. And I'm mostly going to be supporting in the chat. Thank you all for your patience with my lack of tech know-how. So this is going to go great and just so grateful. A bunch of the different cohort members are here today. So if you are part of this cohort and not a presenter, maybe throw up any emoji you want, just so folks who are not part of the cohort can see that you've been part of this really amazing generative process. Awesome. Thanks so much.
Cool. So I think that's all of our presenters today who've introduced yourselves. Did I miss any of our presenters who want to introduce themselves? All right. I think we're good to keep rolling. Elle, I'll pass it off to you. Elle, you are muted.
Teamwork. Thank you. So our goals at the SWHHRC, as explained. So we were seeking to engage, and we did, with grassroots organizations led by people, that's us, with lived experience, as well as advocates in the sex trades. These individuals are trusted information sources for sex working communities across the nation and really around the world who can access hubs for sex workers. And we're seeking to proliferate best practices for HIV response within overlooked communities to fortify trusted, community driven, HIV related education and prevention efforts sustainably. Is this one still me? I thought we had someone else for slide 3.
I'll jump in here, Elle. Thank you.
Hiya.
So just to give a shout out to some of the really awesome sex worker-led organizations that are making up our cohort for the last 6 months plus. And I'm not going to name all of these amazing orgs. I'm just going to shout out some of them. So we have Moho Justice in St. Louis represented in our cohort. We've got the Oregon Safer Workers Coalition. You just heard from Elle. We've got Swap Hawaii. You heard from Kiki earlier. We've got the SID Collective. We've got Entre Putas in Puerto Rico. And we've got Advocates of the South. They're in Georgia. We've also got Below Sea Level Aid. Rouge Support Network, Swoon, that's the sex workers owning our own narratives. So I will just say before I pass it on to my colleague that for me, the highlight of the sex worker health and harm reduction cohort so far has been meeting the amazing people who make up this cohort and just hearing about the work that everybody's up to in different corners of the world because y'all are extremely inspiring. And with that, I will pass it off to Div, I believe.
I think slide 4 is me as well.
Sorry, back to you,
Oh,
Elle.
no, it's great. Thank you for moderating or leading. So, a little bit about our process. We've been meeting together for 10 months, but this specific process that we present to you was for once a month for 6 months. We held breakout discussions for 4 priority populations. Those were transgender sex workers, survival sex workers who use drugs, and BIPOC sex workers, and with attention to the places where these groups overlap. We discussed care access and social determinants of health. Next, each breakout group presented to the entire cohort and sorry, so small on my phone. And we undertook different methods of adding information. Justice and Div compiled and condensed the recommendations and data sources, and we went through 2 revisions and sent our final recommendations to New Moon Network for formatting, and here we are. I believe it's Div or Maya again to present.
Yep. Hi guys, I am Div. So the main thing we want to stress is that sex workers, particularly those of marginalized groups, need to be a priority when addressing HIV prevention, care, and harm reduction. Like with treating any other communicable disease, it's important to take care of the entire population so no group is left behind. So when it comes to HIV prevention, we need to make sure we're taking care of Black, Brown, Indigenous sex workers, transgender sex workers who use drugs, survival sex workers, and those with intersectional experiences. Next slide. As well, in order to provide complete, comprehensive access to HIV prevention interventions, we recommend that people of all lived experiences are provided for. What we recommend is interventions such as home and mobile testing, PrEP, affordable and low barrier hormone access, and programs such as TWIST and Housing First. All of these methods can be scaled to serve populations in multiple languages of all income classes, gender identities, all while taking into consideration their unique lived experiences. Adoption of sex worker harm reduction interventions. Adopting sex worker harm reduction interventions is also very important when reducing infectious disease transmission in the public. When sex workers are safe, they're able to make safer decisions for their health and autonomy. We recommend funding harm reduction education, sex worker-centered drop-in spaces, wellness services, and PROS networks. Improving your own community's health will improve the health of the greater community around you. And I'm going to pass it off to Kiki with a question for the chat.
Oh, I'm on mute. Thanks so much, Div. So yeah, this question, if folks want to please just answer in the chat. We can do like a waterfall style. So if you want to think of your answer, I'm going to ask the question, I'll also put the question in the chat. And then I'll say when to drop your answer. So what are the 3 most important things your community needs right now to stay safe and healthy? And how can your organization or group make those happen? So I know that's kind of like a bigger question, but yeah, like me on just dropped healthcare. Yeah, housing. I'm going to put this back in the chat too so you can see it. Feel free to just drop your answers in the chat. Client/income sources, child care, food. We need 1, affordable housing, and 2, affordable, accessible transportation, immigration, language access, financial support, food assistance. Thanks so much for sharing that. And with this being recorded today, I think it's really important that, we're naming these things so that way folks, when they watch this in the future, can just hear directly from us what we need. We also got in the chat mental health support, the ability to communicate and relay important safety information around sexual health, places to get tested, how to work safer and bad date lists, access to housing and places to work, access to non-judgmental services that can help us stay safe and well, and legal services. All right, I'm going to pass it back to Div for our next slide.
Hi, guys. So facilitating community leadership, sex workers, particularly those of the lived experiences we've discussed today, should be given opportunities to lead these actions and discussions. Sex workers need to be given opportunities for training, funding, and leadership in their own communities. We believe the best people to make decisions for that help and benefit sex workers are sex workers themselves. When this isn't possible, they need to be in the room and at the table for the discussions about them. We need more sex workers included in program design, implementation, and as paid consultants. Partnerships between AIDS service organizations and sex worker service organizations should be explored and encouraged in order to promote public health. Sex worker-led organizations can provide some prevention and harm reduction services. From there, we encourage fostering relationships with health departments and the medical field to open these communication lines between the two communities. Other beneficial partnerships, we need more collaborators in addition to those in the healthcare field. Other partnerships between the sex worker community can and should include things like tech partners, human rights organizations, anti-violence and safety partners, as well as legal advocacy groups, and funders committed to trans liberation and prioritizing health equity. And I'll pass it back off to Kiki with a question for the chat.
Thanks, Div. So our next question, again, just drop in the chat and I'll read them off. When you work with groups that aren't led by sex workers, like health clinics or nonprofits, what's been the biggest problem or barrier you've faced? And what is the best way to ask them to change how they treat sex workers? So if folks just want to think about times that you've been able to kind of break through some of that stigma, or if you haven't, also just sharing that experience. Short answers are fine. You can go ahead and drop in the chat when you're ready. So we have here concern of the wrong issues is a big problem, human resource departments and internal policies, healthcare, rent assistance, community building activities, skill sharing, capacity building, and crafting as a way to combat that stigma. The assumption that sex work itself is a source of trouble in a person's life. Having people with not lived experiences yet be the decision makers for things that impact our lives. Victim blaming. They tokenize us and don't consider our schedules when arranging meetings or ask us for input and availability. Training helps, stories, and actually knowing a sex worker or someone that they love has done sex work. So those are really great answers. Thank y'all for that. You can go to the next slide. Oh, and last one, sorry. Treating sex workers as experts of their own lives goes a long way. Trainings and tough conversations help as well. Not paying sex workers for their time from the beginning, labor exploitation and stealing our ideas, narratives, and work and profiting off of it.
Thanks, everybody, for your answers. Okay, so we will go on to informed sex worker care for everyone. In order to provide care, we need to make sure that providers are not doing any more harm. They need to be informed, sensitive to the needs of, and connected to referral networks of sex worker service organizations. Providers and organizations need to be educated on sex workers' unique needs. They need to be aware and open to the fact that many in sex work are not being trafficked. We need education within these organizations on the needs and experiences of sex workers, as well as audits geared towards destigmatization. Service organizations and clinics must include Black, Native, and transgender sex worker priorities into their plans and ensure representation in leadership and advisory roles. We also recommend a considered rollout of preventative treatments for STI transmission. These methods can take the form of PrEP, rapid testing kits, syringe service programs, condoms of all sizes, lubes, and other materials. They need to be made widely available regardless of income level and location. Medical providers must adopt a destigmatizing, care-based approach to treating sex workers who use drugs and provide patients with safe drug use supplies. In-person working locations such as strip clubs should encourage partnerships with the medical community that allow for their population and venue to have access to what they need to have safe sex and use drugs safely. Mail order distribution is a necessary component of this, particularly for remote populations. Methods of prevention that should be available by mail are condoms of all sizes, emergency contraceptives, birth control, naloxone, testing kits, and harm reduction supplies. In addition to social determinants of health, we must address the well-being of sex workers and the general population. Before people can make safe decisions, they need to be safe. We need affordable housing, we need health insurance, meal services, transportation, health literacy in multiple languages, culturally sensitive healthcare, childcare, legal aid, anti-violence support, and mental health services for all sex workers. Another implementation could be safe work sites and safe overdose prevention sites. Sorry. Policy interventions like overdose prevention sites, safe sex work sites can help reduce both disease transmission and incidents of violence. Overdose prevention sites, such as those in Rhode Island, are places where people can go to be immune to drug law, provided with sterilized supplies and medical care. We recommend the same for sex workers in a way that is peer-led and similarly immune from criminality. We want full decriminalization and destigmatization of sex work and drug use. We need policy that reflects this as soon as possible, that we can make sure our population is not being harmed by the carceral policing system when seeking help. And I will pass it off with a question from Kiki. Thank you, guys.
Thank y'all. This last little bit of our presentation is gonna follow up with our final discussion and Q&A. So feel free to take a little bit of time answering the next question. We'll answer this one in the chat, and then when we get to our discussion, people can come off their mics if they'd like to. So our next question is, if you had the chance to speak with local politicians or police, what is one law or rule you would ask them to change immediately to make sex work safer? And definitely, if you want to think of this in your own context and then also kind of on a larger scale too, that's also great. I'll drop the question as well. Decriminalize sex work. Just one rule. I know, right? There's many. I feel like decrim first would really, really allow us to change so many of the bad laws and language that exists in most of our communities. Yeah, if you wanna think of more than one, please name them. Stop sending Dear John letters, work towards saying that local laws of soap and soda are a waste of tax dollars and are reactive, enact policies that actually aid and not reactive. decriminalization as the umbrella to everything else. Stopping discrimination in banking. Stop stings that use funding for services we mentioned here. Anti-crim. Vacatur or expungement for survivors. Those are great answers. And I think for a lot of us, especially if we're in advocacy or have done this work for a long time, I'll feel the same about these kind of things. So get rid of laws that prevent landlords from knowing they're renting to sex workers. Protect us like you would anyone else. It should be a law. We are humans too. Destigmatization as a policy, no allowing sex workers to be discriminated against in any way for their work. Protect sex working parents from having their children taken away in custody disputes. Yeah, these are all great answers. I think we can move to our final discussion. I want to give folks an opportunity to come out of the chat if you want to, yeah, talk about these things. So our first question.
Real quick, I'm wondering so that people can talk freely, maybe we should stop the recording here as
Yeah.
like the official presentation. So we'll do the Q&A. Thank you to our presenters. That was fantastic. We're really proud of you. This was a great presentation and an excellent publication. So we're going to stop our recording now in 3, 2, 1.